Just one question. I need to share the screen for my presentation.
Yeah, I will make you go.
Okay, perfect.
Okay, just check if you can do it.
Okay, I'll try. Okay, I have to re-enter a second because it doesn't allow me.
Okay.
Okay. You have to allow me again because sorry, I don't know what's going on. But it doesn't allow me to share the screen.
Can you try now?
Okay, I think now, yes.
Okay, perfect. All right. I'm just going to introduce you for a second, and then we can begin. Is that okay?
Yes, yes, we can wait. That's not a problem at all.
Okay. All right. Hello, everyone. Welcome to our career talk on Germany, where we'll be joined by Dr. Vila, who has been so kind to help us with some advice and insight on applying to Germany and working in Germany. And we're very excited to have all of you here. Just a quick note. For those of you who don't know, we have a conference as UIMS team members are organizing one. It's in person in Brno and also online. So if you are interested in medicine or surgery, we have a few workshops for you, a few keynote lectures. And if you are interested, please check out our website, which I've linked in the chat down below. And yeah, if you have any further questions for Dr. Vila, please add them in the chat box as well, and we'll attend to it at the end. Thank you. And Doctor, you can take over.
Okay, so should I start?
Yes, please.
Okay, so hi all. So my name is Daisy Fletas Vila. I come from Spain and I finished my degree about a year ago. And right now I'm in Germany. I got my medical license and I'm here to talk a bit about it and maybe explain you a bit how the German procedure, how it works, everything. And that my main point would be that you have a main idea. What are the steps to follow? How does it work? So you don't find yourself maybe how I found, where everything is new, then there's always new things, and then you don't know how to follow. So I hope it's clear and concise and you can really understand how it works. So right now I'm not working. I did practices in the hospital in pediatrics, but I'm currently in the interview process. I already got 2 job offers and I can explain you a bit about it as well. I know how the specialization works and I will tell you a bit about everything. And at the end, you can ask me questions if there's something that is not clear. So career in Germany. So how does it work? So step by step. So like I said before, for me, the most important is that you understand how does it work. So the most important thing is to know the German language. I know it's obvious, obviously, but without German, it is not possible. A lot of people think maybe I learn a bit German, I'll go there and then hopefully I can start working and then get my medical license approbation there, but unfortunately it does not work. you can do practices, you can work a bit, but without having the minimum required level for Germany, it does not work. So what are the requirements? So it's the requirement is the level B2. So in German, like in other languages, they are classified as from A1 to C2. A1 is the basic, more basic level. C2 is the proficiency. In this case, a B2 compared to English would be like a first. I would be like a first, more or less. It is true that it's a bit harder, it's a bit more, but it is possible. So what I want to tell you is for the German languages, there's different ways. Sometimes people want to study on their own, but I understand that that can seem really long. In my case, what I did was to actually take intensive courses. In Germany, in all Germany, they offer intensive courses, which are 4 hours every day for 4 weeks for each level. So they divide them from A1, and it's A1.1 that lasts 4 weeks, A1.2 that lasts 4 more weeks. Then they go to the next level and to the next level, and they always divide it into 1 and 2, and then this lasts 4 months. 4 weeks, sorry. So 4 weeks. So I finished my degree, like I said, last year, and I started in April, and I studied German for 10 months. It's really short, but it works. And I'm able now to communicate in the hospital. Like I said, I got my license. And if you do these intensive courses, I think is the best, because there's no other way. Like, you every day in contact with German, you every day get to know it, and you speak so much that at some point you just know it, even though you don't want to, you know what I mean? So that's for the language. Then what is the next step? So once you have the language which is required, which is the B2, then the next step is the application for the license to practice. So like I write here in the PowerPoint, application for the license to practice medicine to the corresponding state or district. So Germany has different states. In the state that I'm currently, I live near Stuttgart, and that's in the region of Baden-Württemberg. So I will mainly be speaking about my case because that's what I know the best, but I know a bit about the other states, and it's almost the same, but there's always some little variations. So you apply for this license. At the moment you apply for this license, you also apply for the Fachsprechprüfung. This is an exam, which is a medical exam to obtain the approbation, which is the German full medical license. And then after you have this approbation, after you pass this exam, then you can apply to the desired hospital and a specialty. So this exam, it's not exactly like a B2 exam like you would do in a English exam. It's a medical exam. It's an oral exam which you do with a board of doctors. It's actually 3 doctors, and it consists of different parts, but I will talk later about it. So just that you understand a bit how it works, the process. It's actually very simple. I think the hardest part is to get the language. So applying for a license to practice medicine. So physicians wishing to practice in Germany must become a member of one of the 17 state chambers of physicians, each of the 16 federal states of Germany. So here I just show you a picture just that you have an idea. Here is Stuttgart. I hope everyone can see my PowerPoint. So here is Stuttgart, and I'm in the region of Baden-Württemberg. Baden-Württemberg, it encloses a lot of cities, and here is Munich. So any city that is around is considered part of this region, and you can always apply to this state. What does it mean? This state will have its own rules, and it will ask its own documents. And this, they do it because they say that you should work in the region you apply to. So that means, so if I apply to Stuttgart, means that I want to work anywhere in that region. But obviously it can happen as well that you get an interview in Berlin or in Hamburg, and then you can still work there. but usually they do it so they have the limitation of who works where and how does it work. So just that you understand. So application process, like I said, the authority is responsible for the approval. So once you have the language, once you did the B2 exam and you are ready to take this Fachsprachprüfung, which is the medical exam for the medical license, then you will contact what is called the Regierungspresidium, which is a regulatory body. They are the ones in charge of actually, you send all your documents which are necessary, and then they give you a date for this exam. And they also, at the same time, they process your medical license, meaning that at the moment you pass, you already send all the documents and you don't need to do anything. They will send you the medical license directly. But in order to do the exam and get the medical license, you have to say the documents prior and also pay for the fee. So documentation necessary for the license application and the Fachsprachprüfung. So the proof of B2 exam, like I said, in Germany, it's divided from A1 to C2. The B2, it is not that easy. There's different actually exams. And like I said, each state has each regulation. So some states might require C1. The majority of the states, they require B2 level. So where you can do these exams, you can do this exam in Germany. It also, you can do it in your own country. But usually what they ask is that's from the Goethe Institute. That is from the Goethe Institute. And it's not older than 5 years. Goethe Institute is just an institution, like it would be Cambridge, like Oxford, Cambridge exams, or like IELTS. It's just a type of test. There's other ones in Germany as well, which is TELC and TestDAF, but actually I'm not sure if you're allowed to. I spoke with the Regierungsprozedure and they said TELC would be fine, which is another type of exam, but just to be sure, you always have to check with this different states regulations, which exam do they want. And if you always have questions, you can always email them. They're really nice. They will answer you and they will tell you what you need. So that's the first step, proof of B2 exam. So before you even have B2, there's no point to send all the application documents because you will not get a date. So make sure that once you apply for your medical license recognition, that you have all the documents that are necessary. So then you will need your diploma and supplement. You will need a passport copy, your curriculum vitae. What I want to say, in Germany, they really like precise curriculums. They don't like 3 pages long curriculums with a lot of things. They like to know when and what did you do, and that it's concise and just precise, necessary for what they need. Obviously not that you exclude important things, but they like more shorter curriculums. Then you need a criminal record. You will need it from Czech Republic and Germany. You might need it as well from your own country. So if you're planning to take the exam and you're living, for example, me in Spain, they might ask you to also give it from Spain, but Germany, you need it like it's important, you need it. Then you will need a medical certificate. This you can download from the webpage. Like you see here at the bottom, in the bottom, I put different web pages, which are web pages reference, which you can check all the information that I'm telling you. It's in German, the majority of them. You can translate them. Sometimes they have the English option, but you can translate it in case you don't understand something. And there you can see all the documents necessary. You can check what state you want to do. So if you want to be in Baden-Württemberg, if you want to be in the region of Bayern, it depends. Then you need the certificate of good standing, which you get with your diploma. So that's not a problem. And then sometimes, depending from what country you come from, they might need you to send like a proof of why you want to work in that specific state. So for example, if a family member lives there, or if there's, I don't know, if someone gave you a job and you want to work there, but it's not always, like I said, it always depends on each state and it depends on every requirement. but it's not common. That's why I put it in brackets, but everything else above, that's really necessary. So all the documents have to be translated to German in Germany. So you cannot do it in your own country, translate it to German. You have to do it in Germany and translate it to German. I understand it's a bit annoying, but this is how it works. So what is the Fachsprachprüfung? So just a summary that everyone understands. So you come to Germany, you learned the German, you have the necessary level, you applied for this exam, and now you want to take the exam. So what is it? What consists of, and then resources. So the Fachsprachprüfung. So in German, Fachsprachprüfung means a speaking exam. So like it says, it's a speaking exam, it's a C1 medical exam, and it must be taken by any physician who applies for a license to practice medicine or permit to practice medicine in Germany. So this permit to practice is what I mentioned really shortly, in which you have, German, but you want to start working somehow. Sometimes they can give you a permit to practice, not for all. Sometimes it's for non-EU countries, but mainly it's really hard to get it, and it involves a lot of paperwork. So just the easy way is just to take this exam and then start working. So the Fachsprachprüfung is a C1 medical exam. So this means that it will be mainly about medicine, but also about the language. So it's a bit of a mix, and it depends on the states. So I will explain you a bit more in detail. So the cost is 390 to 600 euros. This means, like I said, every state has its own price. So here in Stuttgart is 420. For example, the people who want to live in Munich, that means that they are in the Bayern region, they might have to pay 600 euros. So that's really important when you're considering where do you want to take this exam. You have to consider what state is better, because in some states are easier, in some states are harder. So that means you will have to take it 2 or 3 times, and that involves a lot of money, a lot of time. So that's also important. For what I would say is that Bayern region, like I just give as example, that's a bit harder. The Baden-Württemberg region, which is where I am, it's a bit easier. Saxon, it depends, but most of the places, the exam is okay. Some places it's just a bit harder. So I would just recommend you just not to go to the harder places, but easier, nowhere is easy, it's just normal. So then, like I said, this is the cost. Here is a web page in which you can read about it, and you can see what are the costs depending on each state. So you say you want to go to Berlin and you want to see how much it would cost if you would take it in Berlin, then you can take a look here in the web page. The duration is 60 minutes, and it's in individual testing consisting of 3 different parts. So the Fachsprachprüfung is a case study of a typical situation in a hospital. A conversation and documentation situation is simulated together with Fachbegriffe, which are medical terms. So basically, you will do an anamnesis. So like I did in, for example, in Czech Republic, you will do an anamnesis, then you will write the documentation. So you will write the report of the patient and what he told you, and then you will speak about it with your doctor, which is what you would do your everyday in Germany. And I think it's really good. So you really learn the language, but you not only learn the normal daily German, you also learn the medical German, which is what you will be exposed every day, and it's the hardest part. So how does it work? So like I mentioned already, it has 3 parts, which last 20 minutes more or less. The exam goes really fast. I would say 1 hour, really, it's really 1 hour. There's no time in between. Everything is timed. It's really fast, but the examiners are really nice. They're patient. They understand as well that the language is hard. So it's not something to worry so much. I think if you study for it and you prepare well, you can pass it with no problem. So it consists of 3 parts. It has the doctor-patient interview. So you will have to do an anamnesis. So you will have a doctor will play a patient. Sometimes they are people who place patients. So not always is a doctor. Sometimes it can be just someone who comes and plays a patient. And he will tell you, so I have pain, I have abdominal pain. And then you have to ask, you have only 20 minutes to ask everything and write down the important information. So they will say, so what is your abdominal pain? Where is it located? How, and everything. You will ask all the questions, and then you will make your diagnosis. And then you have to also have a differential diagnosis, but that you won't say it, you will just write it down, listen to the patient, ask questions. And what is more important, they say, what I think I didn't know is that they say that they only test the language. The medical knowledge is not important, but they are doctors and naturally they just want to ask you medical questions, not so deep, but it happens. So then you will go to do the documentation. The documentation is to write a report. You have to write it how they write it in Germany. And it's just the patient comes because he has pain in the right hypogastrium, epigastrium, whatever it is. And then you will write that everything, how old is the patient, the family anamnesis and everything. And then you will go to the doctor discussion, which there you have to present your patient. So you will say, so my patient comes, and it seems easy, but obviously when you're doing it in a foreign language and you have to do it in German, it seems way harder. But I think the best is to just practice. For me, I practice every day. Every day, ask someone to play a patient with me, and then just repeat till there's some point that it's systematic. And then at the end, so the doctor discussion is 20 minutes, but you have 10 minutes, 5 minutes more or less to do the medical terms. That means there are terms in Latin, which you have to translate in German. So I don't know, abdomen. So you have to translate it. What would be the German word? Not in Baden-Württemberg, you have to write it. You have 5 minutes. In the region of Bayern, you have to just say it orally. So that depends, like I said, it's minimally details that depend on what state you want to do it from Germany. So what is important for you guys as well to know is that there is no limit for the repetition of the Fachsprachprüfung. However, it has to be paid for each repetition. So you can do it 5 times, 10 times, but at what cost? Okay, so then I want to show you a bit of resources. So there's a lot of resources. What I did personally, I did a preparatory course. These preparatory courses are paid by the government. They're really expensive. They cost from 3,000 to 4,000 euros. But luckily, if you live in Germany, you can apply in it's called the Arbeitsagentur, which is a job office. And you can tell them, I'm a medical doctor. I plan here to work in Germany, and I want to take this test. I want to take this preparatory course, and they will organize. It takes some paperwork. You have to show that you have the diploma. You have to talk with the academy you want, and this academy has to be connected with this financing. But if everything works, you get it paid, and it's really, really good. What I seen as experience, there are a lot of students who decide to do it on their own and they fail, unfortunately. Not all, obviously, everyone is different. Some people knows, but I think sometimes you go to the unknown. You don't really know how this exam works. There's really specific things. It's also the language, and it can be that you go the first time alone and then you fail. And then, at least in my course, I found people who did it the first time and then they actually took a course in order to pass it the second time. So as these courses are paid by the government, I really recommend it. And it's not only good because it's not only good for passing the exam, it's also good for your daily life in Germany when you're going to be in the hospital, because in these courses, I did a 3 months course. And this 3 months, it's just talking in German. medically German, you go through how does the examination work, how do you say, what words do you say, you practice the speaking, and basically you everyday talk in this German that once you finish these courses, you really prepared for this exam, you can pass it easily, and then you are ready to take interviews and to work in a hospital. Obviously, there's always some uncertainty, doesn't mean you will know everything, but they really prepare you really good. They offer sometimes 2 weeks courses, sometimes 3 months courses, it depends. That depends on the state, depends on the academy, depends on a lot of things. But obviously what I would like to tell you all is that I understand that going to a foreign country, we all study abroad, and it always can be, I don't know, scary, and you don't know where to find the information and you don't know how to do it. So if during this presentation there's something that's not clear, or if in the future you decide to go to Germany and you don't know where to find the information, you don't know how it works, you have my contact information, or I will give you my contact information. You can always contact me and ask me anything, any doubt, or if I can help you with anything, that's not a problem for me, because I understand that sometimes you just need someone to tell you because you don't know. I didn't know either. I had to find it for myself. So obviously it's easier when you have an idea and you know what it's expecting in the future. So just to say that, so I continue. So then this preparatory courses, obviously you can study on your own. There's a lot of books. So I did this preparatory course, but I also studied from these books. So just a bit explanation of what these books are. So this book is Grundwortschatz für Pflegeberufe. So this book is for studying for the medical terms. So I studied, I think there's 2,000 medical terms. You just have to go every day and study over and over and repeat them over again till you remember. Then there's Deutsch für Ärztinnen und Ärzte. So this is a book in which you have different vocabulary. So they have anatomy vocabulary, they have instrument vocabulary, they have a bit also symptom explanation. Then this other book is as well similar. And then this book as well, they have, so in this exam, you have an anamnesis, but there's a small part which lasts 1 minute, which is called Aufklärung. That means you have to explain what you're going to do to the patient. So that means you have to tell him, okay, so I think you have abdominal pain, so it can be an appendicitis. So we will need to operate you. And then probably they will react, why operate me? What is a laparoscopy, for example? And then you have to be able to explain that. So this book, I think it works really good, and it explains you, or it gives you an example of how you could tell your patient in German what to do. Then as well, there's web pages. So here I put 2 web pages where you can read information about it. The last web page is actually cases. So people who did this exam, who decided that they want to send all the information they had, and then you can read it according to each state. I think it's really good and really helpful. And then there's Facebook groups and also Telegram. But like I said, if any point someone wants to know, they can contact me. That's not a problem. Okay, so after the Fachsprachprüfung. So physicians who are in possession of a valid full license to practice are entitled to apply for a position as a junior physician, which we will call assistant Arzt, at an institution licensed for medical training in the relevant area of a specialization. So what is the next step? So now I talk, what is the process to validate your medical license? So you know the German language, then you decide to apply for this exam, then you pass the exam, and then you have your medical license. So what do you do now? How does the specialization work? And probably that's what everyone wants to know, which is the most interesting. So first I will just explain a bit what are the reasons why I decided to come here to Germany. So there's a lot of systems around the world, and every system functions different. So the good part of a specialization in Germany is that it's really free. What means really free? Means that once you acknowledge your medical license, so once you acknowledge your diploma, you are free to choose the specialization you want. Obviously, that always depends if there's a vacancy. So if you find a vacancy in a hospital, you can start with the specialization you desire. So that's the best part, because in some countries, for example, in Spain, you have to take an exam and then you have to actually get the necessary grade to start your specialization. If you don't, you have to do it again. But everyone finds their own way. But the good part of Germany as a specialization is that it's free. Means you want to start in internal medicine, you can start in internal medicine. The only thing you have to find is a place. So you have to find a hospital that will take you and will say, okay, we have a place for you, you can start working. So I think that's the biggest point to say Germany is really good for the specialization. So that's the first thing that I would say. Then the other reason why specialty in Germany is good is because it's free. So like I said, it's really free. You can change from one hospital to another, and you can acknowledge what you're doing with your specialization. And it's really easy to change. It's really easy. If you start, for example, surgical field, you decide, it's not for me, I don't like it, I want to start internal medicine, you just have to apply for a job position somewhere else. So I would say the hardest part is to get to approve your medical license. So hardest as the language and the time that it needs. So I needed 10 months more or less. Some people might need less if they started learning German already. Obviously, if you start before you finish your degree, start learning German, it will be way easier. I didn't. I knew nothing before I started studying. So 10 months ago, I decided, okay, I'm gonna go to Germany and just started studying German. So obviously, it's way harder. But if you know your German, if you actually got the B2 level, if you then apply for this, and actually you pass the exam, you have the medical license. So this processing takes 2 weeks, more or less. Then after 2 weeks, you can already start applying for jobs for the specialization you want. So what is the next step? I will talk a bit about what is the next step, what is the hospital hierarchy, so you guys understand how it works in Germany, all the healthcare system, and how does the pathway to specialization work in Germany. Okay, so a specialization in Germany, so the duration is 5 to 6 years, depending upon the specific training regulations for the specialty. Regulations on the content and configuration of a specialty training are laid out in state bylaws and the autonomous statutes of the state chambers of physicians. These are based upon the guideline regulations on the specialty training of the German Medical Association. During the training period, junior physicians must fulfill the points in the specialty training guidelines that may apply to the State Chamber of Physicians to be assessed. Upon successful completion of the examination, you will be awarded a specialist diploma, which is called the Facharzt diploma by the State Chamber of Physicians. So just to summarize what all these sentences mean. So basically, a specialization lasts from 5 to 6 years. That depends on what the specialization you want to do. Then how does it work? So you pass your Fachsprechprüfung, you got your medical license, and then you can apply for a position. So you can send your curriculum to any hospital. Then you have to send also a motivation letter saying why you want to work there. And then you say, okay, so I'm ready to specialize here in this hospital. Is there a position? And then they tell you, yes, of course. Then you start working there. And how it works is that there's a special regulations. So it is free, but it has to be regulated. So that means that all the process you're doing, so while you're working, that has to be recorded and has to be written somewhere, how many hours you work, how many days you did, how many tasks you completed. And then after all this is collected, after 5 years, depending on the specialization, after 5 years, then you can go to to the Ärztekammer, so the College of Doctors, and you can say, okay, I'm ready to be a specialist. So then you do this specialization exam, and then you are a specialist. So that's it. It's that easy. I know it seems okay, so you just go to the hospital and just ask for it. Yes, obviously, some specializations are harder than the others, but usually Germany, they're really flexible. They need doctors, and you can pretty get any specialization you would desire. So how does it work? So I will start from the beginning. So like I said, you have to apply for the position. There are two pathways to apply. So one is Bewerbungen auf eine freie Stelle. That means that you are applying for a position available at a certain hospital. So for example, in a web page, the hospital web page, you can go look there. It's called Stellenangebote. And there you can see what positions are searching for assistant doctors. So, or junior doctors or resident doctors, like it's all the same. But then they say, okay, so we need a doctor for internal medicine. We need a doctor for surgery. We need a doctor for this. And then you see, okay, so I'm searching, for example, in my case, pediatrics. So I apply for pediatrics. And because I see there's a free place. Or you can go through a job hunter, like similar to the locum web pages in England. But in this case, they search for a specialization position. Or you can do an initiative Bewerbung. So that means you apply to the hospital you desire, hoping they might give you a spot. That means that I live in Stuttgart. I want to work in the Klinikum Stuttgart, which is like a big hospital. And I want to work in pediatrics, but they're not searching for anyone now. But I want to work there. So I can send my CV. I can send my motivation letter and say, I want to work here. If they find you interesting, or if they're searching for people, but they actually did not say it, they might give you an interview and they might consider you. They might say, okay, maybe now we don't have a position for you, but in 3 months, someone is moving and then you can start working. So both ways work. So if you don't find a free position to the specialization you want, you should not be demotivated, because a lot of hospitals don't actually tell it. Some hospitals, they just like to see who's interested and they wait that someone does this initiative Bewerbung. Both ways work, both ways are good. You just have to see what you prefer. So you might do initiative Bewerbung and also freie Stelle Bewerbung. So just both, just to be sure. Okay, so the availability of positions in the desired specialization depend on demand and offer and vary continuously. What means? That means because Germany for specialization is such a free system and is so variable, it can happen that some people I start internal medicine, I work for 1 year, but then I find my dream position in another hospital and then I change. So then that becomes a vacancy, right? But then sometimes they just hired 3 people, so these vacancies are full, or sometimes they really need people. So that comes and goes. So you should not feel demotivated because you don't find your specialization. Like I said, you will get your specialization. Sometimes you have to be more patient. Sometimes you're just lucky and suddenly they're searching for a lot of orthopedics, and then you can start working directly. So that depends a bit. But even if you start working in another specialization that is not the one you desire, you can still change after 1 year and it's not a problem. And that can be even recognized as your specialization. So applying for a position, like I said, you need to send your CV, a motivation letter. Sometimes they might ask you for the diploma and sometimes they might ask you for your grades. Then you write this motivation letter. In German it's called Anschreiben. And then you say why you want to work in this hospital. And then what will happen is you send it. And then after it depends how many weeks, that depends on each hospital. They contact you and they say, okay, we like your, we are interested to get to know you, can you come for an interview? So how does the interview go? So the interview, you speak with the boss, with the boss of the department, and then he tells you why you're interested. He asks you a part of questions, and then he say, okay, can you come for a hospitation? That means, usually it's a good sign, that means they like you. So what is a hospitation? So a hospitation is a 1-day probation period. So that means you go for 1 day to the hospital. So usually you have to go 2 times to the hospital. So you go, you have a small interview, then they invite you. So then you would start in the morning, like they all start. So at 7:30, then you will be in the morning meeting. You will get to know the team. You will talk to the residents, and then you will actually follow one of them. So you will be with one junior doctor or a resident. It depends on each hospital, and they will show you how does the hospital look. So they will tell you, so our department has this many beds, our department has this, all the good stuff about it. And then you will be there for the whole day till the time that they work. So for example, 4 o'clock, sometimes earlier, it depends. And then they will, so let us say 3 o'clock you finish, then they will bring you to the boss, and then he will tell you what he thought. So he's like, okay, so we really like you, we want to offer you the position. Or maybe there's other applicants and we have to think about it. So are you interested in the position or not? If not, then we will consider someone else. If you are, then we will let you know in 3 weeks, for example, if we want you, or if you can start working here or not. So this hospitation usually are 1 day. It can also happen, for example, so let us say you learn B2 German and you're studying for this Fachsprachprüfung, for the approbation. You can actually ask any hospital and say, hey, I'm interested to work here in the future. I'm actually studying for this exam. I will get my license soon. I would like to be here for a few days, 1 week, 2 weeks, and see how the hospital works. And sometimes they might say, okay, yes, no problem. And then you go there, you every day, and you get to know a bit the German system, which I think that's really good. Some hospitals don't give it, some hospitals, yes, that depends. So the hospital hierarchy, it's not so important, but just that you guys have an idea. So how does it work? So here we have the famulus. The famulus are called the students. So just the students who are in the hospital taking doing practices. Then a student in practicing, yeah. So like they have in England, which they have this F1, F2. In Germany, they just have like F1, let us say, and it's the last year of medical studies in which they just do practices, yeah. So they are just doing these practices. Usually in Germany, they're a bit more, so they're working almost, and you can choose in what department you want. So if you're interested in the surgery, you can do 7 months in surgery, for example, and then 2 in something else, or you don't even need to, you can just do all in surgery. So in case you apply and they would ask you, where did you do your practices? Yeah, that you know and have an idea what does that mean. So here, assistant arts, that's what you start. So that's what I will start. When I start working, I will start as assistant arts. Then I will have a Facharzt. A Facharzt is the person who already is specialized, but it's not an Oberarzt. That means someone who just did the specialization, but didn't apply for a higher position. So it's not consultant yet, it's just a specialized. So maybe he's waiting to get a consultant, maybe he didn't get a consultant position in this hospital, or for whatever reasons. And then the Oberarzt is the consultant. So as assistant arts, you will be in the hospital, you will take in responsibility, but you will always have an Oberarzt who's the person responsible for you. And then we have the Leitende Oberarzt, which is the head consultant, and then the Chefarzt, which is the boss. So he is the person in charge of the department, and the chef arts is the person you always have to interview, which is the most important person. So in Germany, it works, it's a bit hierarchic, and I think you can see from a lot of systems, it always varies. Then I also wanted to explain a bit what is the salary. So the salary is usually 2,600 euros. When you do on-calls, you get 400 to 600. This all depends, and after tax. And then the working times, so it's 40 hours. And then when you do on-call, together with on-call, it can be to 55 hours. So then the pathway to specialization. So here I just have some examples. It's really easy and a bit more complicated at the same time. So what does that mean? That means that it's really easy to just start a specialization. What you need to know is that in Germany, it doesn't work like in other countries. There's no specific program. Some hospitals might have it, but usually there's not. That means that you don't have a rotation program in which you are 3 months here, 3 months you rotate to the next department, then 4 months to the next department. Usually it's depending to you and depending on the hospital. So that means the hospital might offer 6 months rotation. That it happens, it's not always, it depends, and it's really freely. So you can do, for example, 2 years in a hospital, and then, for example, for internal medicine, then you can go to a GP, and you can do GP there for 1 year, and then do something else. So everything is a knowledge, and that's why it's important to report everything, because then at the end, when you apply for the last exam, which is for the specialization, then all this will need to be accounted that you did your times and actually did all that's necessary. So here for internal medicine, just here it's a lot of text, but what is important is here the down part. So the down part, here it says 60 months. So you need to be completed 60 months. So 48 months have to be in the internal medicine, and it has to be minimum of 2 different departments. That means it can be cardio or gastroenterology or nephrology. That means it has to be 2 minimum. So if you are not interested in pneumology, but you are not for 48 months or this in pneumology, but you only 3, that's okay as well, because it depends on each specialty. Obviously, it depends if you want to be pneumologist. At the end, it doesn't work, but that it's really flexible. This you decide yourself. So you say, okay, so I think I want to do gastroenterology and cardiology I'm interested, but this I'm not so much. You're not forced to have contact and be there for 12 months every day in a department you don't want. So that's the good part of Germany. Then here it says it has to be 12 months in a ward, patient ward, in which you are taking care of the patients, and then 6 months in the emergency room, and then 6 months in the intensive medicine. So that means you can choose and organize your specialty how you want. So for example, how to say it? So you want to do neurology, and in neurology, they require 3 years in a hospital, 2 years psychiatry or 1 year psychiatry. That means that, for example, if you don't get to start in neurology, once you're applying for the position, but you get a position in psychiatry and you start in psychiatry, you can acknowledge that year as your specialization. So you can start upside down. So there's no exact way to say, okay, so you have to do this at this certain time, and then after 2 years you have to do that. You can a bit organize it in the way that it goes, and then sometimes 6 months are recognized for any other specialty. So if you didn't get to do neurology or psychiatry, but you started internal medicine, this 6 months of internal medicine will actually be recognized already as your specialization. So I think that's the best thing of Germany, that is so freely that you can organize, but at the same time, you have to know that it's not a program. So you might not get to see everything. You might not get to know everything if you don't actually ask for it, because there's no specific program in which you're doing rotations and this is how it's working, and then making sure that you see everything and you work on everything. That's a bit different, but that as well depends on hospitals. Some university hospitals have better programs, some other regional hospitals have not worse programs, but more freely. So for example, you work in internal medicine and you say, I'm really interested in, I don't know, abdominal sonography or endoscopies, for example. You can always do that with your consultant. You can ask, yeah, I want to start to do endoscopies and I would like to know more about it. You can always do that. Not like in other countries in which you cannot do it till you have completed everything that's necessary. So I would say that's the best thing of Germany, that it's so freely to choose. And it's easy as well. So it's easy as well from change from one hospital to the other. Just have to make sure that you acknowledge everything you've done, that you acknowledge the 6 months that you worked and that. Okay, so then surgical specialization. So I talk about a bit internal medicine, then I talk a bit about surgical specialization. So the surgical specialization that you see here, it's not everything exactly. Actually, for the specialization is a bit more complicated because it's so freely that you just need to know what are the requirements for your specialty. So if they say you have to work 1 year in psychiatry, you just have to make sure that after 1 year you find a place in psychiatry. Some hospitals, they have actually a contract with other hospitals, so they allow you to go to psychiatry for 1 year and then come back to the same hospital. Some hospitals only they say, okay, so you can only do 3 years here, and then after 3 years you have to find yourself another hospital. So that's also important to know. So with so much freedom also comes other problems, but I would say overall it's a really good system. So then for surgery, so here it says 2 years of a surgical basis. So that means, so you want to do visceral surgery, right? So you want to do a visceral surgery. So then you didn't find a place, for example. Obviously, all these are cases in case you didn't find a place right away. So you want to start working in 1 month and there was no free position, or you didn't get an interview for, I don't know, thoracic surgery or visceral surgery, it doesn't matter. But you start in general surgery. You get recognized up to 2 years of surgery. So that means that if for 2 years you work in any basic surgery, you've been in the emergency room, you're in the intensive station, you have done on-calls and different rotations, this can be a knowledge into your specialization. And then after 2 years working in general surgery, then you say, okay, so I want to do thorax surgery, and now I found a position. Then you can do 4 years, and that's also a knowledge. So you don't lose time. So even though you're in one place and then you change to the other, then it's still connected and it still works parts of your specialization. And of course, because it's so freely and you can change and move and go however you want, it's way harder to have a program. That's the reason I think that they don't have such a specific program of rotations, because people comes and goes, and then it's really hard to always organize that everyone has got to see everything when you have to also cover the positions of the people who goes away. So who leaves the job. So then I want to explain a bit, what is the logbook? So obviously you will wonder, okay, so my specialization, they see you said you need to record everything and you need to know what you're doing. So how do I know that? So then exists this logbook, which you get once you start your specialty. You get this book, which describes all the practical experience you should complete and all the skills you should acquire during your specialization. So you use this logbook to document your personal learning progress, such as general skills, work progress, and get feedback from your responsible supervisor every year. So that means you will have this logbook. And then after 1 year, you will talk with your boss And your boss will tell you, okay, so what have you done? So I did this, I know how to do anamnesis now, I know how to do this, I know how to do that, I've been in the emergency room, I did this, and then he signs it off. And for example, if you say, okay, but what if I leave after 6 months from the hospital? Then always after leaving, you will have still a talk with the boss in which he will sign what you've done. So that's the most important, that you always record what you've been doing so it doesn't get lost while you're a specialization. So then this logbook is different for every specialization and it exists for every specialty. So you don't have to worry about that. And it has 2 parts. It has the general skills and knowledge. So that means the anamnesis, all the work progress, everything that you're able to do, and then diagnostic procedures and therapy. So for example, it's so freely here in Germany. So they say, okay, so in order to be a specialized doctor, you need to have done 500 ECGs. So some hospitals make sure that you see that. Some other smaller hospitals might not have time to show you all the ECGs, and sometimes can be extra time, or you have to find it on your own while you're working when you have time for that. So like I said, everything has its pros and cons. Then also, for example, 100 gastroscopies, and here under you can see the link, you can click on it or copy it. I don't know how it works, but you can see it, and here you can read about it. What are the requirements? What do they ask you for the specialty, and so on. So then at the end, so you have the Fachtsprüfung, so that's for the specialization. So you have your logbook, which you filled everything, and you work a specific time. So that means it's really freely, but you need to have worked amount of hours and amount of months. So even though you got to do everything, but you only did 4 years and the specialty needs 5 years, you will still need to work 1 more year. The same that it means that if you haven't managed to do all your skills that you require, so you haven't managed to do 500 ultrasounds and you did only 400, you will also need to do 1 extra year to finish these tasks. So it is freely, but you just have to take in consideration to manage to get to do all the requirements they ask you. So then once you have everything, you can apply for this exam. It's an oral exam with a medical board examination consisting of 3 specialized doctors. The duration is 1 hour, and the content is everything about the specialty. So that was really long. So is there any questions? Is there something that is not clear? Something that I should talk more about it? I talk about a lot of things and I understand it's a lot. I just hope that you understand the main process of how can you work in Germany? Because that's the thing. Once you already got the medical license and you start asking for the specialization, it's way easier. Then you get to see how it works, everything. You can always find the information. That's a really good thing. So I think from there, it's smooth, I would say.
Thank you so much, Doctor, for your amazing talk. We learned so much and it was very informative. I have one question before we get to any further questions that you guys can leave in the chat. But my question was, you mentioned that you can do the FSP in any state, but does it matter that you do it, say, for example, you do it in one state, but then you apply to another state for jobs? Does it make a difference?
No, it doesn't make a difference. So basically in Germany, they say if you do it in that state, you have to work in that state. But if you, for example, do it in Baden-Württemberg, which I am, but you get a job offer in Hamburg or in Berlin, you can still work there. That's not a problem. But I think they just do it as security, that not everyone is just asking everywhere and then applying and working in different. They try that people who applies in that region, they stay in that region, but you're free at the end. So it's not a problem to go to another state and work. I would say only important what state for the exam, because some exams are easier, some are harder. It's the same exam, just a small variations, but failing it, having to pay again, obviously makes a difference. So I would consider reading a bit about it. And I can say already my state, it's easier than Bayern. Bayern is harder. Other states are easier. So I would say Bayern, maybe it's the hardest. So whoever wants to go to Munich and applies for that region of Bayern, just that they know that maybe they should consider somewhere else. I hope that clarifies.
Thank you for your answer. We have a few more questions. So what if someone starts a specialization in another country and at some point during the residency, they decide they want to work in Germany?
Okay.
So do you have any information about that?
So that I'm not 100% sure. I think it's more complicated, but it is possible. I think you will need the German language. I think every step. So even if you're a specialized doctor and you want to work in Germany, you have to first recognize your diploma and know the language. So everyone who wants to work in Germany as a doctor has to do this exam. So that's why I said that's the most important part. So let us say you start your specialization in England and then you want to go to Germany, you will still have to do the exam the same as someone who just finished a medical degree. So then you will do this exam, the Fachsprachprüfung, and then after that, then you have to recognize what you did in your specialization. So that will take paperwork, signing off how many hours you did, what are the requirements. But I think Germany is good in that because it's so freely. I don't think it's a problem to move halfway while you're doing your specialization. You will find a specialization easy, and it's just paperwork to recognize it. But obviously the main part is this German. It doesn't matter if you already work 10 years and you're specialized and want to work to Germany, you will still have to go through this exam and this process. Everyone has to do it. It's just how it is.
Okay, thank you for your answer. The next question is, so can you do some hospital practice while also studying the language?
You can. I would not recommend you do it if you don't have B2. B2 is the requirement level for everyone who wants to work in Germany, not only medical professionals, but also anyone who wants to have a job. So if you want to work in a supermarket, or if you want to work, I don't know, any job that you can imagine, they will require that you have B2. So if you want to do these practices in the hospital, you can ask for it. But if you don't have B2 level minimum, I think they will not give it to you. So there's no point to ask it. Once you have the B2, then you can ask for it. It's not that easy. Before it was easier, but now a lot of people ask for these practices. What I would recommend is to always say you're interested to work there. I think that always works. When you say, this hospital, I really like it, I'm really interested, and I would like to see it before I get my medical license, I think they will most probably give these practices. The duration, I think, cannot be longer than 1 month, because longer than 1 month is only for students. So once you have your diploma and you're a doctor, it only allows you to do for 1 month these practices. Sometimes they do it 2 weeks. And in the same hospital as well, it can only be 1 month. So you can do 2 weeks in one hospital, in one department, and 2 weeks in another, but you cannot do more than 1 month in the same hospital. And I think that's it. You can do it. It's hard. It's definitely hard, but you can do it. I think it's a good experience just to see how it works. So I would definitely recommend it. And yes, it is possible. It depends on the state. It depends on what city. It depends on the hospital. That's the thing. It's so freely that you just have to try and see if you get practices or not.
Okay, we have a few questions coming in. Someone here is asking if we can get the lecture from you.
Yeah, of course.
If you can just leave that in the comments at the end. Okay, great. And the recording, so we are working on uploading it on YouTube at some point. So just follow us on Instagram, and then you'll know as soon as we have it uploaded. Johnny also asked, are there any scholarships for the A1, B2 language skills, as there is one for medical language course?
Okay, so that depends on the state. It is possible, but mostly I think there is some courses. I think so. If you have to be in Germany to get this scholarships. So if you are in Germany and you apply and then you're jobless and you want to learn German, I think sometimes some academies work with this job center, and they can give you some money that you can attend these courses. I think it depends, but I think it is possible, but it involves paperwork. You have to sign up for them. You have to go to the major house. You have to register yourself as a citizen here in Germany. If you are, even though you have EU diploma, if you're non-EU member and you live abroad, you have to sign up for a visa. And then after you did all this paperwork, then you can contact the job center, and they sometimes give you the possibility to do this intensive courses in German and pay for you. So yeah, that's possible.
All right. So Adeyemi is asking, I was wondering if you know how much they value clinical experience in other countries. I plan on going traveling for a few months after medical school, and I thought that doing some placement like in Thailand or US, something for 2 weeks at a time, do you think this will help getting a job in Germany?
Sorry, can you repeat the first part? I didn't hear it.
So they were planning to do clinical experience in other countries, for example, in Thailand or the US for around 2 weeks. And do you think that will be helpful? Do you think that in Germany they would recognize that as like a good experience?
Yeah, I think definitely what Germans value the most is language. So your language skills play a big role. They really like that. They really like people who are motivated to do research, because like I said, you have your boss, and usually the bosses of the hospitals are people who did PhDs and gone into research. So they really value someone who work in another place, work in other countries, someone who is highly motivated, someone who knows a lot of languages, someone who has practical experience. Because actually, I think in Masaryk University, we don't have that much practical experience. German students actually have a lot of practical experience. The last year is basically working. So obviously, whatever practical experience you can get, it's always a plus for Germany. So I would definitely say yes, that's good.
Okay, our next question is, do you know if a German citizen will also need a kind of FSP or talk with the doctors, or do they just have to skip it?
They don't have to do it. If you know German and you're German citizen, you just apply for the license, you send all the documents, like I said. So the documents you have to send for the application of the license are the same. You don't have to do this language exam. This language exam is for the people who actually are not German and don't know the German language.
Okay, and then we have another question about your experience. Could you tell us about the first few days of your residency? What was it like for you? Were you under supervision or were you alone?
Okay, so these hospitations, so it's different. So when you start working, it's a different experience. When you do this hospitation, basically you follow the residents. So that depends on each junior doctor or resident, like you would like to say it. So the ones I was there for 2 weeks. So it's hard at the beginning. It's hard to understand everything in German and get to know how it works. But I would say after 3-4 days, it gets much easier, and especially after you did a medical preparatory course. So basically you're there, you go in the morning, you're in the morning meeting, then you follow assistant doctor, like they call it in German, assistant Arzt. So you follow them, and then sometimes in Germany they have to take bloods, put IV lines themselves. For example, in Spain, we don't have to, the nurses do everything. So in Germany, you have to do it. So if you know how to do it, they might ask you, okay, you can go take bloods, you can do IVs. If you know how to write the documentation, they might ask you, do you know how to write documentation? Do you want to write it? So they're always willing to give you tasks if you're able to do it. If you're not able to do it, you can easily say no, and that's still okay. They will just show you and explain you how it works. I think assistant doctors are always really busy, so obviously they don't always have time to explain everything. And when you go as a hospitation, you're a possible employee, so they don't explain you like a student. So they expect you to already have the knowledge, just follow them. And if you can do some practical skills, you can do it. If you cannot, then you just follow them, and they will show you a bit how it works, the system, how do they, for example, it works in the computer, how do they do this, how do they do that, but they won't be explaining you as much as medical knowledge, because that's supposedly you got it already from the university degree. But I would say overall, my experience was really good. Everyone is really nice. Whenever I had a problem or difficulty with the language, they understood. They have a lot of doctors who come from abroad, so they understand already and they know how it's hard. Even the residents are foreign students, they're like foreigners as well, so they understand it, and they will, whatever problem you have, you can ask them, and they're really nice. So that's my experience overall, I think. I don't know if I missed something, some point.
That sounds great. I feel like it always helps to know if you are with other foreigners that it's accepted, and that if you don't know the language, it's okay. We're all learning.
Exactly.
All right. So my next question is about the visa. Do you need a special visa to work in Germany if you have a European passport?
No. If you have a European passport, you're part of the EU, you can stay in Germany. You just have to sign there that you're actually living there, and you can stay, I think, as long as you want. I don't know. I'm EU member as well. I'm from Spain, and I didn't do anything. I just came here and registered and live here since then. No visa, nothing.
Okay, our next question is from Hind. So in your experience, you just purely focused on the language first, or did you prepare for anything else?
So basically, till I reached B2 level, I just did language. That's the most important. I think that's what takes the most time. That's the hardest part, because you in university, the medical knowledge, you can always revise, but another language, learning how everything works, I think that's the hardest. So that's what I concentrated the most. Once I got the B2, then I started this medical preparatory course. And there what I started is to actually study medical things, but in German. So for example, in this preparatory course I did in an academy called ISMAP+. They're really nice. They do it really good. And what we did is we worked with AMBOS, but in German. So we would go through the diseases in AMBOS, and we would just go through it and the German medical terms. So I think that really helps to relearn it. So you know it in English, now you just have to relearn it in another language, know what the terms they say and how they say it. So that was my second part. So first language, and then medical language plus medical knowledge, but in German. I bought some books, I don't know, for example, pediatrics book, but in German, just to read about it, to see how it works as well. Every country has its guidelines, so definitely you will need to have those when you start your specialty in Germany.
All right, and our last question is, when it comes to applying for a job, what exactly do they look for in your CV? What do you think?
So like I said already before, languages, I definitely a plus. Someone who studied abroad, I think it's considered really good. So I think they like that. I know some other countries, it varies, but I think here in Germany, they like that you know English, that you actually worked. I think they really like practical experience. Like I said, so the more practices you did, the more courses you did, the more things, it always adds up. And if you had even experience already working, that's even more plus. So for example, to say, so you start a specialization in Germany and then you do 3 months, that's already better for you than starting from new. So always it adds up. So it's not considered a bad thing that you worked, or that you had experiences, or that you took a bit longer to, I don't know, you finish your degree, but then you're studying German. That's as well good for them, because just knowing the language, knowing practical skills, I think that's what mainly they would like. They ask. I think they also like to know that, so when you are writing your CV, not too long, just short, minimal, not too many things. They really like simple. Like a lot of times they say just simple, just dates, what you did, and that, and then just a part what your experiences or your skills are. And I would say that's mainly all. They're usually really nice. I think usually when you write a good motivation letter explaining about why you like the hospital and you actually mention the parts they have there in the hospital, which you are more interested about, they usually give you an interview and then see who you are. I think that goes well, and they search a lot of doctors. So there's definitely a lot of positions available.
Sorry.
Okay.
I had one last question. Thank you for the nice
Sure.
presentation. Basically about the surgical specialization, when you were speaking about the slides, I didn't quite understand. So basically you need to do 2 years general, like basic practice, as you explained, and then 4 years, because you said like, even if I don't find a position in a hospital for a specialization that I want, for example, I still can do 2 years. And then when I find, I can apply for the position and do 4 more years.
Exactly.
Okay.
So basically surgery is 6 years, right?
Yeah.
So you have to work 6 years. What does that mean? Like I said, Germany is really free. So you can always change from one hospital to the other, from this position to that position, and everything that you do in the way it's a knowledge, right? So if you want to do, there's some surgical specialties which are apart. So for example, neurosurgery, it's something apart. So that's not considered to the surgeries that I talk about it. Gynecology is also not part of this. But if you want to do a thoracic surgery, and then you don't have to do 2 years of this general surgery. You just up to 2 years are recognized. So that means that if you would start even 6 months in general surgery, and then you would change to thoracic surgery, this 6 months you did will be a knowledge into your specialization. So it's 6 months less you have to do.
I understand. And when you say, like, for example, neurosurgery is not a part, what do you mean? Like, it's not.
So that means that general surgery would not be considered as part of this specialization.
So it's like addition years.
Exactly. So that really depends on the specialization. Like I said, it's more specific, but just that you understand some specializations have allowances of others. So for example, so for thoracic surgery to visceral surgery, if you start in general surgery, that will be a knowledge. In neurosurgery will be different, but usually 6 months are a knowledge from any other specialty. So if you would do internal medicine, that 6 months can be also recognized into your general surgery, for example. So it really varies. This you have to read. And like I said, I sent a link already in which you can read that and you can see what the specialty. So if you do pediatrics, if you do surgery, if you do internal, what would be recognized? So so you can think about it. So if I wouldn't get the first time, I wouldn't get my specialization desired, but I would start in another department. Would be a knowledge into my specialization or not? So that you can look it up. So that's what I wanted to explain a bit. So that a lot of times some specializations are recognized into others. So that's why it's so good in Germany that you can freely. So if you don't start here, you can start somewhere else and then move. Does that make sense?
Yes, yes, I understand.
So that's what I meant generally. I hope that clarifies your question.
Yeah, it makes it clear. Thank you very much.
Okay.
Okay, we have another question that's popped up. When doing an intensive course, as you did for 10 months, is it possible to work during that time, for example, in research, or would you say there's no time to do that?
Okay, so I think these courses are usually 4 hours every day. I started from 8:30 more or less. I say 4 hours more or less, but I don't know exactly now if it's 4 or 5 hours, but it's from 8:30 till 12 o'clock. You can work. For example, in Germany, there's mini jobs, which would mean a work for anything else. If you want to work in research, I think till you don't have B2 level, it is not possible, except it would be in English. So if you want to work anything in Germany, you have to have the B2 level. So once you have the B2 level, then you will have to do this preparatory course for this exam, for the medical license. And these preparatory courses are way longer. So these preparatory courses usually start at 8:30 till 2 o'clock or 3 o'clock. And then you will have to study for the exam. So then there's not much time, but you can always try for it. I think there's never anything wrong to just look for research if that's what you're interested in, and apply for it. If they say no, then say no. If they ask you for the language level, then you can do it later on. So I would always recommend to try it, because you never know. Some places they actually take you, some places they don't. So, but definitely if you don't have B2 level, I think it's really hard to find anything at all.
Okay, I think that was the last question we had in our chat box, and everyone's just sending in their thank yous now. So I think we'll let you go. Thank you so much for your time, and thank you for being so patient with all of the questions.
No problem.
Would it be possible for you to send the lecture on the
Yes.
chat box?
Yes, of course.
Wait for that.
I just want to clarify that obviously it's way more complex. There's way more details, but like I said, I sent in my lecture, there's all the links to the web pages so everyone can read it. Or if anyone has a question, I will also send my contact details. You can ask me for it. But if you choose to go to Germany, which I think it's really good, because I think it's a good system and I like it, then definitely I would recommend you to first focus on the language and then move step by step, because everything will come. So once you reach that level, you pass the exam, you get the license, you will see that everything is smoothly and it just goes easily. It's not so complicated as it might seem at the moment. So that's all.
Thank you. Bye.
Thank you. I will send now my